Hey, good morning. Today we're going to talk about the hospital processes and staff of the hospital. And we have la doctora Hernandez, la doctora Thompson, and your guest, the Dr. Mena. Uh, I'm going to talk about medical products and all this. Okay, the first step to entry to registration. Sometimes registration can be done before arriving to the hospital. It consists of completing a serious form that collects basic information such as address and name, health insurance information for the person to be hospitalized, the telephone number of relative or friend with whom to connect is emergency. Consent to the to provide the information to company. The identification bracelet is placed on the patient to wear on the wrist. It is necessary to check the data of the identification bracelet to refer the information. It contains incorrect and necessary for bracelet to be worn all the time. Uh, Nursing are technically staffed down blood, usually between 5 and 8 in the morning. Extracting is done early to the clinical in the hospital. Survey can review the result relative soon. The medical visit or floor is carried out at the last ounce a day. During the visit, the doctor does the follow, ask the patient about their symptoms, take a scan, inform the patient about a scheduled test, and change the treatment plan. They usually take place in the morning. The doctor may visit the patient several times. In some case, the doctor may be completed by a member of the nursing or pharmacy staff. During the doctor is training or a combination of health professionals. Uh, if a test or surgery product is scheduled, the patient is not allowed to, to eat or drink something for a period of time, often from midnight the day before the test or surgery. During this time, fluids are given to patients through EV, uh, which are usually placed when you are admitted to the hospital. The schedule of tests and products can change suddenly if emergency occurs. And now we're going to my co-worker, la doctora Thompson.
Okay, me escuchan.
Sí.
Okay. My name is Daphne. Voy a pasar a exponer. The group of physicians and healthcare workers who are responsible for a matched medical needs who, whilst the patient is in the hospital, endu- enduring a reasonable follow-up period. Residents, internet, and medical students. Some hospitals are designated a teaching hospitals that, that is, the hospital. Things include medical, studenthood are at various um, stage of education and who are supervised by the aesthetic physi- physician. A resident or intern is a fully licensed doctor who is engaged in further trained after a graduate from a medical school. Um, as though these members are not attained physical, they of act, active members of the team. La voy con la autora Hernández.
Hello, my name is Susanna. I will be talking about attending physician. The attending physician is the leader of the team and has responsibility for all decisions made that affect a person's care, including diagnostic, treatment, and supervision of the remainder of the team. Based on the problem that brought the person to the hospital, the attending physician may be a doctor who is trained in internal medicine and work only with people who are hospital as surgeon or another specialist physician. In a small community, the person primary care doctor may act as the attending physician, especially when people have complex or serious medical problems. The attending physician sometimes take care that specialists evaluate the person and recommend how to best diagnostic and treat the problems. For example, the specialist may be doctor who is extensively trained in the diagnostic and treatment of the disorder of the heart, cardiology, kidney, neurology or cancer, oncology, registered nurses. People usually have more contact with the registered nurse assistant to their care than only other members of the team. Get through to people and monitor and evaluate their physical and emotional needs. When person conditions suddenly changes are of the fears to defend the chances, they report the chance to the attending